Well, welcome back. Grid 7. Thought I'd do this little thing. I've seen this before. No, actually, I've seen this this problem before the lockdown even happened. Now, they were talking about this type thing. Now, it says 94% of Americans who died from COVID averaged 2.6 additional problems. In what may be a stunning announcement, the CDC stated 94% of Americans who passed from the Wuhan virus had other types of health conditions and contributing causes, along with COVID-19. This, to me, it's kind of like pneumonia. Pneumonia by itself, most people recover from. Now, when you've got other problems, it can become a killer. Same thing here. Now that they went and done a lot of provisional data from the week ending February 1st through August 22nd, the CDC stated that for 6% of the deaths, COVID-19 was the only cause mentioned. The only 6% of all the deaths. And I think, 4,000, 200,000, what is that, 12,000 deaths, really, out of 200 for deaths with something going causes in addition to COVID-19. On average, there were 2.6 additional conditions per death. That's pretty significant. Now, these people were already problems. Now, they already had health problems. Now, especially if you think about the elderly, a lot of them do have everything. Now, if you take a look at this, influenza, pneumonia, respiratory failure, respiratory arrest, hypertensive diseases, cardiac arrest, heart failure, sepsis, not familiar with that one, diabetes, and Alzheimer's disease. Alzheimer's. Those are, a lot of older people get that. They have those problems. And by themselves, all these can be major problems on their own. Well, the CDC said provisional information is not yet complete and it should not be compared across state lines. They also say the numbers, which are based on death certificates, are the most reliable source of data. And right here, here's the basic math on all this. Of the 183,000 Americans deaths from COVID-19, about 11,000 were solely contributed to it. And the others more likely had more than one underlying affliction. Of course, this isn't minimizing any loss of life. It is critical. But to me, this highlights something that I don't think we're doing right. These people with these problems are the ones that should be protected. And part of that is kind of a herd immunity, which we're not doing. So, are we really doing the right thing by all this? Of course, you had New York that put COVID patients in probably the worst area, retirement homes and stuff like that. But you won't hear much about that one. That got to protect those Democrats over there, and bad Trump, even though Trump's the one that sent, never mind, going off on a ramble. So, we tend to make it out that that COVID, oh my God, I'm going to get it, I'm going to die. No, if you have all this other stuff right here, be extra cautious. If you don't have it, you're not going to be very likely to die. And I wonder how many of these right here, again, had something else happen. They went to the hospital too late. They didn't, for whatever reason, something happened that they didn't do. And it's an interesting cause. But, what do you think? That's my 2 cents. And, I'll see you next video. So later.